and welcome to another episode of the Health Notebook. I know it's the holiday season and it's summertime, and today we're looking at a common medical condition known as epistaxis, and this is known as a nosebleed. And we have Dr. Khan in the studio once again, and we'll be exploring the topic of epistaxis. Dr. Khan, welcome to the studio.
Thanks for having me again.
Okay. I know we've touched base previously in terms of tonsillitis, and today's topic we're looking at nosebleeds. And just coming out, I know there is a slight association between weather and nosebleeds. Can you maybe just give us some information pertaining to the relationship between the two?
So when the weather is very hot and the air starts to dry out, our noses dry out, and people that are prone to nosebleeds then often have nosebleeds when the air gets hot and dry.
Okay, so what actually happens in the nosebleed? Just to explain to the viewers, you've got various blood vessels, but just elaborate a little bit more on that.
So the nose is a very vascular organ with lots of little blood vessels, and there's an area inside of the nose called Little's area. It's in the middle part of your nose where there's quite a lot of blood vessels. These blood vessels are very near to the surface of the skin, and there's very thin layer of mucosa over the blood vessels.
So when you mean mucosa, what in simple terms? What
in simple terms, it's a thin tissue layer, mostly mucus lining, and not as thick and tough as the skin that we see on our body. And when this lining dries out and cracks, the blood vessels underneath can easily come to the surface and crack as well and cause nosebleeds.
Okay. And what are some of the other causes of nosebleeds? I know you've spoken a little bit about the weather, but what else can cause nosebleeds?
The most common cause, and in fact 90% of the time, is caused by trauma, and we call it local or digital trauma, which is basically your own finger or something that goes in your nose and scratches on the area and causes nosebleeds. So scratching in the nose is a very common cause of nosebleeds.
Okay, now in terms of signs and symptoms, I know you've obviously would see the blood, but what other associated signs or symptoms might accompany a nosebleed?
So the most common one is bleeding from the blood just coming out of the nose. Our patients that see a lot of blood, that are not used to seeing blood, can also feel very faint, and some can even collapse when seeing the blood, and we call that the vasovagal effect, where the sight of the blood can sometimes cause a shock and patients can feel faint and fall over.
Okay. Now, in terms of the volume of blood, obviously it depends on how much of the blood vessel is affected, but how would you classify it in terms of nosebleeds?
It's a tricky thing to classify because a little bit of blood can often look like a bucket of blood. So I'm sure if you spilled half a teaspoon of blood on the floor, it will look like you've thrown half a cup, and the blood would just feel like everywhere. And people tend to overestimate the amount of blood. So often our patients may have lost very little blood, but they feel like they've lost a bucket of blood. And especially the way it stains a tissue or a handkerchief that you put to the nose, it can look like a significant amount of blood, where in actual fact it can be a mild trickle.
Okay. Now I know you've brought some material with just to explain to the viewers as well. So I'd like to thank you for bringing the material with, so that the viewers can understand exactly what you were speaking about.
So what I brought is a small anatomical diagram of the nose and the ear, but obviously now we're focusing on the nose to see where the nosebleeds come from. So if you look at over here, you'll see this is the face, and these are all the structures in the face. If we were to look from the side, we'll get the picture that you see on the side over here. And if you look over here, this is the nose over here. Okay. And then the middle partition of the nose is over there, and that's called the septum. And just about in the front area over here is Little's area, and that's the area that's extremely prone to nosebleeds. And that's the area where one's finger often touches against when scratching inside the nose.
Okay. Now, I know you've mentioned about other causes of nosebleeds, or can you just inform the viewers of, you've mentioned 90% is the spontaneous nosebleeds, but what about the other 10%? What are the other 10% causes of nosebleeds?
Other 10% cause of nosebleeds can be from a septal deviation. So, like I said, the middle partition of the nose that separates the nose into the right and the left nostril is called the septum, and it's about over here, over there, that's the line pointed to the septum. Now, we can have what's called a septal deviation when a portion of the bone is pointed out to the one side. And what this causes is a difference in the way the air moves inside of the nose, causing the side where the deviation is to dry out more easily. And again, that can cause it to crack more easily and cause nosebleeds in that area more easily.
Okay. Now, in terms of red flags for nosebleeds, so what are the red flags or sort of the most important aspects that the viewers need to be made aware of that requires emergency treatment?
So emergency treatment I would put in for patients that are on blood thinning agents, so patients that are on warfarin, that are taking aspirin daily. They can have a very severe nosebleed that can't stop on its own. Other cases can also be in patients with hypertension, so if you have a high blood pressure and sometimes the blood pressure is high, and that can also compound the effect of a nosebleed. And those are the two cases where I say would be most important. The other thing is if the nosebleed is just not stopping with basic first aid and you start to feel faint, that would also be.
Now just touching in terms of the treatment, you've mentioned first aid. So if you could just explain to the viewers what should be done immediately when they do see that their nose is bleeding.
Okay, so first aid is very important, and there's various misconceptions around the idea of first aid for nosebleeds. So I'm going to say first of the important thing to do is to pinch the nose. So you want to pinch the nose at the area at the bottom, which is where the 90% of the nosebleeds are.
Okay.
And you want to pinch onto that for about 5 minutes. And that would stop most nosebleeds. Now it's important to say where we're pinching, because often we get told by various people that you need to pinch on top, on the bone of the nose.
Okay. Do you mind demonstrating for us exactly the area of
So the exact area to pinch is right at the bottom of the fleshy part.
Okay.
And you just want to pinch there for 5 minutes.
Okay, so
like,
5 minutes.
Yeah, and like I said, we often get told to pinch on top by the bone, which is incorrect. Some people suggest wet or cold cloths on the forehead or even the back of the neck, which also have no effect at all. The most important thing, I'm going to reiterate it once again, the most important thing is to pinch right on the fleshy part of the nose, right at the bottom.
And in terms of positioning of your head as well?
So the positioning of the head, neutral position is good, or even leaning forward, not leaning back. Again, sort of an old wives' tale is to lean back, but what that would cause is for any blood to actually go down the back of the throat. If we lean forward, the blood will come out, and that's perfectly fine.
Okay. Now let's assume the 5 minutes has gone by. What's the next step if the bleeding has not subsided?
So if the bleeding has not subsided after 5 minutes of pressing, I would advise them to go and see either the casualty section or the emergency section at the hospital, where they can attend to the bleed. Okay.
Now what types of management would be available now? You've taken the person to casualty or the emergency section. They identify that it is a nosebleed, obviously, or they exclude other causes. So what would be the management then in the hospital environment?
So in the hospital environment, and on the first point of contact, if you've got no contraindications, so contraindication being on a blood thinning agent, high blood pressure, the most obvious thing to do, or that your general practitioner or even the casualty officer may do, is to actually burn the area of the nose with a silver nitrate stick. So that's a stick, a long stick that looks almost like a matchstick head. You just touch on the area of the bleed, and it causes the blood to clot in that area, and then nosebleed to stop.
Now in terms of packing the nose, I know there's also the concept of packing the nose first and then burning the area, or
so most bleeds will stop with burning the area if it's visible. If it's a difficult bleed and one cannot see where it's coming from, often that can be a bleed deeper back, and that one won't stop with simple burning the area, or even we sometimes prescribe nasal cream that can stop the bleeding, that you can use 3 times a day for 5 days. If that doesn't work and the bleed is more posterior, then your doctor may pack your nose, which is a technique we use where we put gauze inside of the nose, pack the nose totally full of gauze, and then stop the bleeding from there.
Okay, so let's assume you're having now reoccurring episodes of bleeding. You went the route by applying the silver nitrate, correct, to the area. You've also had your nose packed. What other options are available if this is a reoccurring problem?
So if it's a reoccurring problem, especially in the occurrence of a posterior nosebleed, then you may need surgery where we can cut off one of the arteries, or not cut off. I would rather say we can stop one of the arteries that supply the area where the bleed is often occurring. So those arteries will be embolized, and they will no longer provide blood to that area where bleeding was.
And that would be a formal operation?
And that will be a formal operation, yes, with full anesthetic, and you will be asleep for the procedure.
Okay, now I know there's also medication available that one actually would use to treat the intermediary phase of the nosebleed. So can you maybe just elaborate a little bit on the availability of medication?
So it's an antibacterial cream that we can use at the base of the nose, just to decrease the chance of infection in the area and to allow the nose time to heal, and then thereby stopping the nosebleed.
Okay, so you've mentioned the antibacterial and you said there's another one as well. Are they both antibacterial or?
Yes, they're both antibacterial nose creams.
Okay. And in terms of nasal moisturizers and...
So if you're someone who's prone to nosebleeds, and there's certain things that can bring it on a bit more frequently. Simple things like working in an aircon environment, working in an environment where there's fans in the room, or even sleeping in an environment where there's a fan in the room or aircon. Again, this just promotes drying out of the nose, and a dry nose is more prone to bleed. So good advice to stop the chances of you getting recurrent nosebleeds would be to remain well hydrated, so drinking lots of water. And then if you're in an environment where there's a chance that the nose may dry for whatever reason, be that aircon or out on a hot sports day or something like that, one can use a little bit of Vaseline just on the fingertip, rub it on the inside of the nose on either side, and allow the nose to be moisturized and decrease the chance of having a nosebleed in that situation.
Yeah, we've completed nosebleeds, and there are a number of common ear, nose, and throat conditions. Another one being sinusitis. In simple terms, can you explain to the viewers what a sinusitis is?
Okay, so again, I'm going to point over here to my picture.
So just say again, I'm going to point to my
Yeah. So again, I'm going to point to my picture. So what I'll show you is anatomically on the face, within the skull, we have anatomical areas called the sinus. And these contain the frontal sinus, the maxillary sinus, and we've got ethmoid sinus and so on. And the sinus is an anatomical structure. So often patients come to your doctor, your general practitioner, and you say, "Doctor, I've got sinus." So for your doctor, that's basically like telling him, "Doctor, I've got leg." It doesn't have much say on what your problem is.
So that is in terms of meaning, because there are a number of sinuses.
Exactly, and also, sinus means different things to different people. So for your doctor it will mean an anatomical structure. For you it may mean you have a blocked nose. It may mean you have a runny nose. It may mean you have a headache that's associated with a blocked nose. It's very difficult. So it's quite important to tell your doctor exactly what you mean when you say I have sinus or sinusitis.
So would you then advise the patients to describe as in the location where they're feeling the pain or the congestion?
And the symptoms. So they can say I'm feeling congestion, or I'm feeling a runny nose, or a blocked nose, or I'm feeling very stuffy, and these things help your doctor in providing the best treatment for you. So if you can tell him exactly what your symptoms are, it's much easier to provide a better treatment.
Okay. Now I know you've mentioned sinuses, and so if you can just explain to the viewers what's the role of a sinus.
So the sinus drains mucus from within the skull and into the nose, and allows and mucus has very important properties in the body. So it will trap any dirt or dust within our nose and take it to the back of our throats, where it can either be swallowed or coughed out depending on the thickness of.
So it's sort of a protective mechanism. Okay, and in all these sinus areas, one is expected to find the mucus as well.
And so you were asking me about sinusitis, and sinusitis is often referred to as infection of the sinus areas. That's when the mucus can either be retained for whatever reason, or there can just be so much mucus that's not draining well, and that can be infected by bacteria, or bacteria, virus, or fungus, and that can cause a sinus.
So this is actually then the inflammation of the lining of the sinuses. Okay, so my understanding is that sinusitis is the inflammation, so it can either occur on its own, or it can occur as a complication of another illness, for example, the upper respiratory tract infection. Absolutely. So are there any causes of sinusitis?
So other causes can be mechanical abnormalities. So if you have a septal deviation, as I described just a few moments earlier, or nasal polyps, or anything that can cause difficulty with the mucus to drain out of your sinus, can make you more prone to having illnesses like sinusitis.
Okay. And obviously there's also the allergic sinusitis. Just to touch a little bit on that, what is, in simple terms, what does that mean?
So in simple terms, what you're referring to is allergic rhinitis, which is basically a episode, what people know as hay fever. So you can have an allergic response to pollen in the air, or house dust mites in your bed, or dust in the air, and that can cause you to sneeze a lot, and cause your nose to be runny. And this episode may be about 1 or 2 weeks, in which case your GP will probably prescribe antihistamines for you to get over it. Or it can be a chronic condition where you have constant runny and blocked nose that's just not getting better, and then a nasal steroid or nasal spray will be your first line of defense again.
Okay, so I know we will be covering hay fever and allergic sinusitis on another episode, but just going back to the sort of the main sinusitis or the inflammatory infective sinusitis, how would a patient or how would a member present in terms of a sinus, a typical sinusitis? Maybe just describing the maxillary sinusitis or the frontal sinusitis. What's the variation in terms of presentation?
So it will be very difficult to say from which sinus the sinusitis is coming from, but the symptoms are often quite similar. So you'll have fever, you can have congested headache where your nose feels very full all the time, your nose can be very runny and very blocked and stuffy at the same time. But the main differentiating factor between a sinusitis and an allergic rhinitis or allergic runny nose is the fever. And one can be very ill with a sinusitis. It can actually knock your body can take quite a knock, and you can feel quite ill with it.
Okay. Now, in terms of the signs, now you have a patient coming to you. Is there any signs that you might pick up in terms of sinusitis as a medical practitioner?
So your doctor may feel your pulse, and your pulse can be a bit faster than normal. Again, your temperature, take the thermometer and check your temperature, and your temperature can be quite high. It can range up 38, 39, and in bad cases even 40 degrees. The nose will be quite runny, and here the mucus can be of a color, so it can be quite thick, yellow or green color, but it can also be see-through color. The mucus's color is not very it's not a diagnostic criteria to say what type of illness you have.
Or to confirm it. Now, I know there's also the percussion just to sort of localize the sinus.
So your doctor may feel along the sinus areas as I pointed on the picture, and if you're feeling very tender or painful around those areas, that can also lead towards sinusitis.
Okay. Now, in terms of treatment, is it self-limiting? Would you require medication? What do you suggest?
So treatment is necessary, and you may need an antibiotic and some steroids to get over it, and that's usually the first line of treatment. Is antibiotics, steroids, and then nasal hygiene and douching, which is basically rinsing the nose with a saline solution to try and get rid of as much of the mucus as possible. If treatment fails, you may require further investigation, which can include a CT scan.
So that's sort of a scan of the sinuses.
A scan of the sinuses, so we can see if the sinuses are full of mucus and if they look infective. And from there on, you may even require surgery where the sinus can be washed out to get rid of all the bacteria inside of it.
And that would be the sinus washout, the so-called sinus washout. Okay. I know you also use some fancy equipment to get a better view. Can you just explain that process as well?
So we can use our flexoscope, which is a flexible scope that we can put inside the nose, and we can actually have a look inside the nose and see the type of mucus that's draining.
So you don't have to put the person to sleep?
We don't need to put the person to sleep for that.
I think that's one of the most common fears of viewers, is that for some of these procedures they under the impression that they need to actually be put to sleep. But so you put a tiny little camera?
Yeah, so it's a very thin camera on the end. The specialist can look on the one end and basically see the other end. The camera has a bit of a light on the end that's going in, and from there we can look inside the nose and see if there's any pus draining from the sinuses.
Okay, so I know you've touched a little bit on some of the approaches to a non-resolving sinusitis, but what about the reoccurring episodes of sinusitis? So I get it every few months, or it's a common pattern?
So if you're getting it recurring, I would then suggest that your GP refer you to an ENT specialist, and the specialist can then see if there's any mechanical reason for you getting recurrent sinusitis. So like I mentioned earlier, if there's anything that's blocking the drainage of the sinuses, or if the sinuses themselves are just not well developed and they're not allowing the mucus to drain and to get rid of the infection.
So let's assume the sinusitis goes untreated. right? What are some of the complications, or what other areas can it affect?
So it can, because of the close proximity the sinus has to the skull and to the brain, if the sinusitis gets very bad and forms an abscess that's not drained or cleaned, they can sometimes erode into the skull and into the skull base and even cause a meningitis and infection in the brain.
Okay, now, and in terms of affecting ears, and I mean, can it also spread to the ear?
There is a small chance that it can, that the abscess can go that way as well and drain through and go into the, but it's a bit less of a chance than whether if the abscess would go into the brain, that would be more serious.
So just going back to the misconception, I know it's a common misconception in terms of sinusitis and hay fever, and just the general perception out there is that if you in certain areas, people would say that they develop sinusitis. For example, if you're staying near an area where there's a lot of flowers or trees, or you stay near a coastal area, or you maybe go to Johannesburg, and people come with these individuals' histories of developing sinusitis associated with a specific location. But I know there is sort of a misinterpretation. Can you just elaborate a little bit in terms of giving the viewers some advice?
Okay. So what we were talking about for the past couple of minutes has been sinusitis, which is more infection of the sinuses of the skull, and that's different from experiencing runny or blocked nose when you're in a certain area, because that's more an allergic rhinitis.
So that is exposure to some of the antigens within the environment, which is small proteins.
Yes, so you're having an allergic response to the environment. So the small proteins which can come from pollen, can be from various types of trees, can be from cat, can be from dogs, and as I said, from house dust mite, the bed bugs. Those things can irritate your nose to cause you to sneeze, to have a runny and blocked nose when you're in a certain area more. And often we get patients that, especially coming from perhaps the Langebaan area where they have lots of flowers in Veldrift, Langebaan area, and they have recurrent.
So those are the coastal regions
and areas with a lot of pollination, and they tend to have allergic rhinitis, and that can be seasonal or it can be chronic. So it can come with different seasons, or it can come all the time throughout the year. That's different to the sinusitis that we were talking about. As I said, that's an infection of the sinuses, and from there you get all the side effects of infection. Fast pulse, you'll have a temperature, and you'll feel a lot more unwell than someone who has a blocked and runny nose throughout the year.
Dr. Khan, it's been a great pleasure having you in the studio.
Thanks for having me. It's been a pleasure to be back.
And we actually hope to we actually hope to speak to you again in the future, and we'll be discussing the topic of allergic rhinitis as well, just to give the viewers some information and an approach to manage the hay fever as well. So there you have it. We've discussed nosebleeds, which is commonly known as epistaxis. And just to sum up, the most important takeaway message here is, if you do develop a nosebleed, remember to pinch your nose, hold it for 5 minutes, move your head forward. If it doesn't resolve, you need to see a medical practitioner, or you need to go into an emergency room, because you can lose a lot of blood. Thank you for watching, and stay tuned for another episode, same time, same place next week.